She's going to talk about changes in visual outcome, IOP, and astigmatism in patients undergoing combined surgery.
Good morning, one and all. I'm Dr. Harita. Today I'm going to speak on a comparative study of changes in visual outcome, intraocular pressure, and astigmatism in patients undergoing combined surgery. There are no financial interest to disclose in this study. Coming to introduction, intraocular pressure being the main modifiable risk factor in treating glaucoma. So lowering intraocular pressure helps to arrest or delay progressive optic neuropathy, and this prevents irreversible visual field loss. And cataract being the leading cause of audible blindness worldwide, studies have shown that postoperative intraocular pressure could be lower when cataract surgery was combined with trabeculectomy. The main aim of the study is to compare changes in intraocular pressure and visual parameters in patients undergoing phacoemulsification with trabeculectomy with small incision cataract surgery combined with trabeculectomy. Main objective of the study is to compare changes in visual outcome, intraocular pressure, and astigmatism both preoperatively and postoperatively in phacoemulsification with trabeculectomy versus SICS with trabeculectomy. Coming to materials and methods, this is an observational study using convenient sampling. I have taken 40 patients with cataract and coexisting glaucoma and divided into two groups. Group A patients into 20 who have undergone SICS with trabeculectomy, and Group B 20 patients who have undergone phacoemulsification with trabeculectomy. The study was done for a duration of 6 months, and the study tools used were Snellen's visual acuity chart, Goldman applanation tonometry, and automated refractokeratometer. Informed consent and ethical committee clearance was taken. Coming to inclusion criteria, patients with age 40 years and above were included. Patients who are having visually significant cataract according to LOCS 3 grading were considered, and patients with coexisting primary open angle glaucoma based on Humphrey field analysis mean deviation score, moderate and severe glaucoma were considered in this study. Coming to exclusion criteria, patients with secondary glaucomas were excluded, and patients with any other ocular trauma or previous surgeries were excluded. Coming to methodology, all the patients underwent preoperative and postoperative evaluation for visual acuity, keratometry for corneal curvature readings, Goldman ablation torometry for measuring intraocular pressure, and 30-2 Humphrey visual field analysis was done. And comprehensive posterior segment examination was done in all the patients. All the surgeries were performed by a single surgeon, and the incision site was superior for SICS with trabeculectomy and superior temporal for phacoemulsification with trabeculectomy, and patients were followed up after 1.5 months. Coming to statistical analysis, the data in the two groups were compared preoperatively and postoperatively using pair t-test, and between the two groups it was compared using independent sample t-test. Surgical induced astigmatism was calculated using SIS software, and the data was analyzed using Microsoft Excel datasheet. P-value less than 0.05 was considered statistically significant. Coming to results, comparison for changes in uncorrected visual acuity, best corrected visual acuity, and intraocular pressure preoperatively and postoperatively in the individual groups were compared, and they showed there is statistically significant difference preoperatively and postoperatively in all the parameters in the individual groups. While comparing surgical induced astigmatism in SICS trap and phaco trap, there was no statistically much significant difference between the two surgeries. Comparing visual acuity and intraocular pressure between the two surgeries, there was no much statistical significant difference between the two surgeries. Coming to discussion, in my present study, it was considered that combined procedure has showed better visual outcome, better control of intraocular pressure, and fewer complications in patients with coexisting glaucoma and cataract. Similar studies where in one study they have compared phacoemulsification versus phacoemulsification with trabeculectomy in primary angle closure glaucoma patients. In a study of 79 patients, it was shown that phacoemulsification combined with trabeculectomy is more effective in reducing intraocular pressure and lessens the need of glaucoma drugs when compared to phacoemulsification alone. And another study with which has compared phacotrabeculectomy with small incision cataract surgery, has shown there is no statistically significant difference in the final visual outcome and intraocular pressure and postoperative complication rate between the two groups, similar to my study. Coming to limitations of the study, in this study I've included only patients with primary open-angle glaucoma, and patients with mild glaucoma were excluded. A longitudinal follow-up over a period of 6 months to 1 year is needed to study the comparison effectively between the two procedures. Coming to conclusion, combined procedure, it showed better visual outcome, better control of intraocular pressure, and fewer complications in patients with glaucoma and cataract in both the groups. As the combined procedure helps in handling the two morbidities in a single setting, this reduces the need for glaucoma medications, frequent follow-ups, and also blends post-operative IOP spikes following cataract surgery. These are my references. Thank you.
What was the type of incision used for SICS in the combined surgery? You didn't mention about that, because that will really be making a lot of impact on type of
corneoscleral incision.
No, corneoscleral what? Straight,
the,
frown, or Blumenthal type?
It was a frown incision.
So you should mention that. No?
So
But you did not find any difference in the SIA between this combined
not
SIC
statistically significant, sir. The difference was there, but not statistically significant, sir. P-value was... there was a difference between the two in SIA, sir. In SICS group, the mean was 1.35, and in phaco group it was 1.073, but this was not statistically significant.
It is rather unusual, but do you think that, sorry, I am confused about one thing. You followed it up for 6 weeks or 6 months?
6 weeks, ma'am.
6 weeks is too short a period. Do you think bleb remodels over a period of time and
Yes.
can cause changes in astigmatism?
Yes, ma'am. That's why I've mentioned that it needs longer duration to compare procedures.
So then, do you think your results are valid?
Not.
Okay. At least you're honest.